Economic approaches to valuing health improvement seem to get a few key things very wrong. That economists would routinely predict that treating people in very, very poor health states at the end of their lives or in very, very sick quality of life states, economists would say it's not so valuable to do that. Yet ordinary people, both in terms of what they would spend their own money on, in terms of what insurance companies would spend money on, in terms of what governments would spend money on, they seem to act very differently. They seem to think that it was valuable to do those things. And so it led me to believe there was something very wrong with the way economists were thinking about the world, and that this would have a lot of negative implications for how economics was used. It would lead to fewer breakthroughs to treat the most vulnerable patients, for instance. And that's why I embarked on really a 10 or 15-year process of doing research in this area to document these problems and to come up with solutions and better economic frameworks that properly capture the way that people think about their health and improvements to their health. So, new medical technologies to treat severe illnesses are like insurance policies for all of us. Because now that I live today instead of in 1985, if I come down with an infection of, let's say, HIV, I know that drugs exist to help me live a normal life. Whereas if the same thing had happened to me 50 years ago, that would not have been the case. So I'm insured and protected. And it's very valuable because it's such a severe illness. And those kinds of dynamics were largely ignored by economic theory for many years. And it led us, I think, to undercount the value of breakthroughs against severe disease. Getting value right means that we incentivize innovators to work on the problems that humans care about rather than the problems that economists had erroneously guided them to think about through, I would say, more limited and incomplete models and theories.